pop through. That's a cystodilation. And I thought that was more. I thought that was $300-400.
Okay. Do you know what percent of the time do you do the first one, that's the 200, versus the one where you're also using a camera?
Depends on the patient. Actually, moving more and more towards the second one. The camera, unless it's the first one is old school. It works, but it's not for it's for established patients who just keep doing it. But more younger or newer patients, and more and more, what would I say? How often do we do it? I probably end up doing 50-50 in the end.
Okay. 50-50.
I mean, the regulars keep doing the first one, but the new patients are the ones that you're not sure about. We're doing mulatto and cystodilation.
Okay. So the patient population that are the established patients that just keep coming back. And you said that's about 50% of your patient population. I mean, how many patients would you estimate a year for you in your practice?
How many different people, or how many times are we dilating? Because they're recurrent, they're frequent flyers. How many guys do I have with strictures that I keep seeing? Probably 20.
20 guys.
How many how many times do we do dilations over the course of the year? Probably 75.
Okay. And then of the people that I guess aren't frequent flyers, does the first time work for them, or do they eventually come back for a repeat procedure as well?
Almost everybody comes back, unfortunately. The statistics say that the first try is your only hope of it really working. I think it says that it could work up to 50% time. But honestly, these patients still come back, and they're always worried that there's a little bit of stricture, and we look inside, and there's always something soft in there. So the rate is high, almost everybody. How many people come back? 80, 90%.
Okay. And then in terms of reimbursement, is there, I guess a stipulation of how many times you can collect reimbursement on a patient? Or can they just keep coming back as
No, there's a lot of other things in urology which do have limits. This one does not have a limit. If it's legit, if it's documented, we're allowed to dilate. We should dilate.
Okay, perfect. Can you help me understand, does private insurance play a role here, or is it all patients submitting for or qualified, I guess, for reimbursement, or how does that work?
We don't have any insurance. I don't get so involved in it. I have my back office do it, but I've never had a problem. I've never had a denial of a dilation of a stricture.
Okay. Do you ever do any mechanical dilations in the hospital setting, or is it all done in your office?
Mechanical means just bluntly. If I take somebody to the hospital, it's because it's more severe. I mean, I need a laser or a knife. I don't know exactly what mechanical. If you mean by mechanical, just expanding it, we almost always do that in the office. No, a young guy I'll do in a surgery center. Between a hospital and office, there's a 20-year-old guy that I'll give him some propofol in a surgery center, and then we'll do a mechanical dilation. So like most mechanical dilations done in the office, we do a few in the surgery center for younger guys who can't take it.
Okay. How many a year for the younger guys would you estimate?
How many what?
How many younger patients do you have annually, would you estimate, that would have to go to the surgical center?
2 or 3.
Okay. Thank you. So when you say laser, are you referring to the DVIU procedure?
No. Let's say my idea. DVIU is with a cold knife.
Okay.
Laser is, some of my colleagues do it. I rarely do it. If I see like a stone, a calcification on the scar tissue, then I'll use a laser in the hospital, but rarely.
Okay. And is there